Well, my name is John Waits. I'm a family physician and OB by training. I'm the CEO of Cahaba Medical Care, our headquarters here in Bibb County, where you are today. Thank you guys for making the trip down. Cahaba Medical Care is a 501c3 nonprofit community health center. We get the pleasure of serving 42,000 unique patients in 27 locations around central Alabama, half of them rural, half of them urban, and we're here today to talk about women and children. Cahaba has 3 OBGYNs and 14 family medicine physicians who are board certified in obstetric care, serving in 3 different labor and deliveries at St. Vincent's in Birmingham, Medical West in the Bessemer, McCalla area, and right here in Bibb County, where you're sitting today, about 200 yards that direction, is a rural labor and delivery served by physicians, nurse practitioners, nurse anesthetists, and a broader group of physicians, nurse practitioners, behavioralists that do prenatal care. A few years ago, my colleague, Dr. Kathy Lavender, and colleagues at my alma mater, the University of Alabama, published an article in the Journal of the American Board of Family Medicine showing that 2 family physicians that did an OB fellowship that moved to rural Pickens County in West Alabama, when that hospital reopened to labor and delivery with 2 family docs, the infant mortality dropped 10 points. And these control counties, the yellow counties, were rural counties that had labor and deliveries open, and the blue counties are rural counties without labor and delivery services. And you can see the difference that made. A couple of years later, Dr. Lacey Smith, co-founder of Cahaba, and I published in the Annals of Family Medicine a study of 15 years of publicly available data. We took rural counties without access to labor and delivery over that period of time, and rural counties with access to labor and delivery over that period of time, and you can see a statistically significant 2-point difference in infant mortality, perinatal mortality, and neonatal mortality. This is not news. We have known this for half a century. Nesbitt and others in Washington State published this data back in the early 90s. This is a geocoded map of the state of Alabama of travel time for women in 1980. Fast forward 30 years, here's what it looked like in 2011 for women to drive over 30 minutes in the areas remote from those hospitals. Here's the headline from last year: driving 100 miles in labor, giving birth in the ER. Fears rise as 3 maternity units prepare to close in Alabama. 2 of those were in urban areas. One was Baptist Princeton in the west side of Birmingham, where our providers provided care. The others in the wealthiest county in Alabama, Shelby County, lost their only labor and delivery. Monroe County in rural Alabama, Demopolis in rural Alabama, rural Grove Hill Hospital. The headline is, labor and deliveries do not make money. In 2010, Dr. Lacey Smith and I approached an innovative, visionary hospital CEO, Joseph Marchant at Bibb Medical Center, with a proposal to shore up his medical staff on all channels: geriatric, adult medicine, and for women and children. He took us seriously, trusted us, and over the course of the next 10 years, we built the state's first teaching health center here in Bibb County that's expanded to other rural and underserved urbanized counties. We now have 60 family medicine residents practicing in underserved HRSA shortage areas in central Alabama, with an underserved placement at the end of training 3 times the national average, and rural placement 5 to 8 times the national average, speaking to what can happen with HRSA support in FQHCs and teaching health centers around the country. We have an OB fellowship that is part of HRSA's primary care and training expansion, and a QIF grant. We have 2 OB fellows, and this type of workforce development that HRSA has helped sponsor in Alabama covered the hospital's financial blindside, allowing them to take a leap of faith and invest in the first reopening of a closed rural labor and delivery in Alabama in half a century. This labor and delivery opened in November 2015, right here in Bibb County, again 200 yards that way, and features the normal prenatal care and advanced ultrasound that we were providing in our FQHC, but also local delivery and operative obstetrics right here in rural Alabama. It took a team of not just physicians, but nurses, nurse anesthetists, and alumni of HRSA-sponsored OB fellowship training programs and teaching health center alumni like Dr. Laura Lishman and Dr. Jamie Bishop, and alumni of the Tuscaloosa Family Medicine Residency Program, Dr. Elizabeth Lee. In the years prior to this labor and delivery being open, despite having local prenatal care, the infant mortality rate was triple the state average, triple the national average, double the state average. In the years subsequent to this labor and delivery opening, you can see the linear decline approaching the national average of a low infant mortality rate. Back to this map of Pickens County. This map is what inspired a young medical student in the 1990s to do family medicine obstetrics for his professional career. And it hasn't escaped my notice that today, not only is Pickens County closed, their labor and delivery is closed, but the two control counties of an open labor and delivery, Clark and Monroe County, in the last 18 months have closed their rural labor and delivery. We know how this story ends, statistically, on average. So, covering each other's blind side, collaborating, working together for women and children, I am so grateful that HRSA has assembled this great group of people to think about affordable access to care for women and children. And I'm glad you all made the trip, and I'm looking forward to this convening. A warm welcome to you. Thanks for being here.